So hello, I'm back. Again, my name is Dr. Bernard Ashby, and I'm a vascular cardiologist. And today's topic is going to be dealing with cardiovascular disease, more specifically atherosclerotic cardiovascular disease. Now, basically, a lot of folks know about heart attacks, but most folks don't realize that heart attacks and most strokes are related because they're both caused by atherosclerosis, or at least the majority of strokes are. So basically, what is coronary artery disease? It's really a plumbing problem. Essentially, it's related to plaque buildup in the arteries. So if plaque builds up in the coronary arteries, which are the arteries supplying the heart, that can lead to a heart attack. And when it builds up in the arteries in the neck, that can lead to a stroke. Now, the next question should be, what causes plaque formation? And that's all the things that we talk about. High blood pressure leads to plaque buildup in the arteries. High cholesterol leads to more plaque buildup in the arteries. Smoking, which is one of the strongest modifiable risk factors, leads to plaque buildup in the arteries. And as does diabetes. High sugar in the bloodstream leads to plaque buildup in the arteries. And so I'm just kind of connecting the dots here. And a lot of times when we talk about risk factors, that's exactly what we're talking about, things that lead to plaque buildup in the arteries. And so we know that if you mitigate or decrease those risk factors, you have less of a chance of developing a heart attack or stroke. And that's basically what I focus on for the most part, is prevention. So things that lower plaque buildup in the arteries are things like exercise. The more you move your body, the less plaque you form. Folks who are sedentary tend to have more heart attacks and strokes because sedentary lifestyle leads to more plaque buildup in the arteries. Also, folks who smoke, folks with uncontrolled diabetes, uncontrolled high blood pressure, all those things lead to heart attacks and strokes, which are things that we try to mitigate. Now, when you come see me as a cardiologist, I try to assess your risk of developing a heart attack or stroke. And essentially what I focus on is lifestyle changes. So if you're overweight, I try to help you to lose weight. If your blood pressure's high, I try to talk to you about different lifestyle ways to decrease it, such as decreasing stress, decreasing salt intake, and watching what you eat. And that's the same thing for diabetes. One of the things that I dislike most about the way my colleagues tend to practice is that they immediately prescribe medications, when in fact a lot of things can be changed through lifestyle modifications, such as decreasing the sugar that you eat or the carbohydrates that you eat. Now, once I know what your risks are, again, I always start with lifestyle. However, some folks need medication. If your sugar is really high, you'll need medication. If your blood pressure is really high, you'll need medication. But again, the lifestyle is the foundation of mitigating your risk. So, in the future, we're going to take questions and get some feedback from you, the audience, to talk about ways to decrease your risk of heart attack and stroke, but also we're going to talk about other topics beyond this. But if you have any questions specific to coronary artery disease, heart attacks, or atherosclerotic disease of the cerebrovascular system, i.e. strokes, feel free to chime in. You'll receive our newsletters, and you can be able to reach us via social media, Facebook, Instagram, Twitter, or emailing us at Your Health, okay? And you should have that information on the screen. But again, we have a whole host of information to bring to you, and we look forward to building with you in the future. Thanks.